I'd like to introduce you Elena Bonfiglioli, General Manager for Global Health, Pharma, Life Science at Microsoft. And she will talk about how Europe is paving the way for trustworthy AI in healthcare. And it's a great pleasure to invite Elena. She's a great speaker, a great professional, a great friend, and she has the ability to transfer complex and strategic thoughts into a simple and engaging way. And I'm happy that she's here with us today. We are preparing her. And Elena has this unique ability to charm us with the topics in healthcare, and she has such an extraordinary experience around the world in a global. She can see that from various perspectives, from the pharma, the life science, the technology, and so take the opportunity to ask her questions. And because it's a unique opportunity to have her here today. And then after Elena, we will talk about sandboxes. Voila, Elena.
Yeah, they couldn't mic me up.
No? So okay. Okay, you will, you're okay?
Hello, hello. Good to see you.
Thank you.
Good morning. How are you? Yes? So, as Stefano said, I had the pleasure of working in healthcare and health policy for a long time. And I would say that when I look back, I would have never expected an opportunity to have such an acceleration with incredible tools that actually were not medical tools, but were digital tools that got to transform the way clinicians do their work, the way researchers do scientific discovery, and the way patients can interact with health system. When I started to work in this field, we were talking about telemedicine. Wow, big thing, right? And you know what? The interesting thing is that if it wasn't for COVID, we would have never discovered the scale benefits of telemedicine. And yet, human nature is so that we don't learn from the past. And so telemedicine is still not pervasive. But the tools are there. Why am I saying this? Because when you think about the new tools that we have at hand, artificial intelligence, they have the opportunity to do many things. And I'll share with you what that is. But there are questions and barriers to adoption. So the issue is, why, if we have a good tool that can save time, that can give better outcomes, that can give you more precision in the way in which you discover medicines, or can give the patient a better experience, why are we not embracing that? And it's always a question and a mix of capabilities, trust, and incentives. These three things, no matter which tools, no matter which wave of enhancement, of innovation, these three things need to align. You have to have people that know how to use the tools so that they're confident in using it and they have the trust that these tools will work for them as the old tools or better. And then they need to be incentivized. And telemedicine is still not there because we still don't have a uniform policy for paying these doctors that do the telemeds. So when you shift now to today and you think about artificial intelligence, everybody is wowed for what it can do. But many people are scared, concerned about the safety, the trustworthiness. So the biases, the hallucinations, So what are the safeguards that we need to put in place to be sure that not only the potential of artificial intelligence is clear, but the trustworthiness of the responsibility of these AI tools are evident, intuitive, and adoptable. That's the conundrum in which we are today. And if you don't agree, please raise your hand, because I'm looking for different perspectives. Okay? That's not me, that's not me, that's not me. That's not my deck. I can talk without slides, but if we have slides, it's better. No, that's not me. No. That's Andrea. Yeah. Okay, I'll keep going. So you got the framework, right? Thinking about that conundrum between fantastic potential of AI and responsibility of adoption, we thought about launching one initiative, a global initiative, that was also brought to Europe, and that's called TRAIN. So the Trustworthy Responsible AI Network. And that's what I'll talk about today for one reason. Because you start from principles. Everybody says our AI is the most responsible. We take that very seriously. We started with responsible principles even before AI was there, because we wanted to answer one question. It's not what computers or machines can do, because they can do a lot of things. It's about what they should do, aligned to societal values and preferences and governance and decisions. So we shifted from the principles which we had outlined and which we adhere to a framework for implementation. This is very important, because it's not about only the principles and the safeguards that we put in our technology, but it's a process in which the user can really embrace those safeguards. When AI lands in an hospital environment, or when it lands in a pharmaceutical environment. So with that, we don't have, shall I?
It's uploading.
Yeah? Do you want my computer? I can, if, it's good? No, it's not this. Look, I love it when I don't have slides, and look, here they are. I sent them through, but if you want, shall I pull it up? Yeah? No? Wait a second. Wait a second. Here it is. There you go. If you can show that, better come prepared. So where I will start from is what can AI do? And then how can AI be responsible? What can AI do? I think I outlined it at the beginning. So first of all, and I would love to know from you if you have seen examples of this. You've seen examples in which, thanks to AI capabilities, or even, analytics capabilities, and now even more general AI capabilities, we have the opportunity to identify patients that in health systems are going around with cardiovascular risk, with risks of kidney chronic conditions. Study was made in the UK in which about 1 billion could be saved just by the opportunity of identifying patients those are my slides. If you can put them in show mode, thank you. So patients that have opportunities to be treated, to be medicated early, and to be identified in the right way as early as possible. That's one of the things that AI can do today. also that means, if you think about pharma, that we could do clinical trials matching much faster. If you think about the fact that oncology is a rare condition today, because every cancer is very specific, then you could start taking all the clinical trials that have been done before, run those through AI capabilities with the large language models that we have today, and extract some of the patterns of how to look at the results that would best match a specific phenotype. When you start doing that, you then can start matching the future clinical trials that you want to run with some of the characteristics of the people, look at the data sets, and really design a trial that is much more precise. At the same time, you can have agents. You used to call them chatbot, if you remember that, but it's intelligent, smart agents that know your profile as a patient. They know which medicine you have to take in the morning versus the afternoon. They nudge you. They are a reminder for you. But most interestingly, I don't know how many of you know the Dragon solutions. Microsoft acquired Nuance a couple of years ago. Nuance solution is what's responsible for the basically the speech to text. So a doctor dictates, and that voice is transferred into a text. That's how it used to be. As if this was a mic, you would, on your computer, you would see everything I've said, which is very helpful because we have a span memory normally of 7 seconds. So that would be helpful. Now, with consent, without my mic, looking at the patient in the eyes, I could be talking, making sure that I observe how the patient is, talking about it, say, or listening to what the patient says. All of this with consent would be captured in text without any time, which is pajama time, where when I go home, I need to go transcribe that or have somebody else that does it. And then it can be queried. I can review it. There are levels associated of risk. I can refine that. Human is in the loop, and it goes straight into the electronic medical record. That is called now Dragon Ambient Intelligence, and is a new category of AI, which is clinical, so clinical grade ambient intelligence. So all those things are possible, but then the question is, how do we apply the right principles inside these solutions? Number one, how do we apply these principles when these algorithms land in the hospital environment? How do we assure the clinician that these are reliable and the outcomes pre and post are with a positive delta if I apply an algorithm? Similarly, how to make sure that in a discovery of medicine, in a drug discovery phase, those algorithms are understood, transparent, monitored, reliable, and all of that. So those responsible AI principles were launched much before the Gen AI time, but they still apply, and even more so they apply, because when you think about fairness and when you think about what feeds Gen AI as data sets, if my data sets are not guarded against biases, it's clear that the outcome will be suboptimal, because the output of an LLM will not consider part of the population that I need, and therefore it will not be inclusive. Reliability and safety. Are those results accurate, right? In terms of from patient chart summarization to all other list of capabilities and criteria that one wants to identify and prioritize. And then when I look at actually inclusiveness, is really important because making sure that those AI capabilities are accessible across a variety of population segments will make the technology better and will make the outcomes better. And then verification, there is a point in the transparency part of those AI principles that really looks at how can I verify what the AI is telling me. Imagine that I am a radiologist and there is AI imaging capabilities, so that radiologist, I go to screen for my mammography. We know that 1 out of 3 remains with high propensity for errors, which is a big issue from a gender standpoint in terms of gender equality of outcomes. And as a radiologist, if I'm assisted by the algorithm, I need to be able to click on that image, if it tells me that there is something there, and verify why, and verify what is the reasoning behind that, so that I have a chain of control that I, with my clinical expertise as a human in the loop, can verify and validate and accept. It cannot be a black box. So when you start from those principles, the question is, very good. I don't have time to reflect on all of this when I have patients and patients and patients to see. I need to have an automated safeguards that goes to implement these type of principles for me and much faster in a transparent way, in a way that becomes almost like a registry. And this is why in March, in the US at HIMSS, we launched the TRAIN initiative. You can imagine, there was a big adoption across US systems. And the first question that some of us Europeans in the global team asked is, how do I get into a Thales or a Eurostar? Because that train for me doesn't work if not, right? So we launched in Europe at Health in June. You see some of the early adopters. I hope that in a year from now, we have many more European organizations, because the power of that network will come from its members, will come from the sharing, will come from the learnings that they are going to bring together. So first of all, congratulations to Erasmus and HUS and Scone and Vita Salute. I was very, very pleased to see San Raffaele there. And then Utrecht, some collaboration with Foundation 29. There are discussions that go from Germany to Belgium and other countries. It is foundational, because we cannot talk about an AI transformation without the adoption of the principles that stand behind that AI. If not, nobody's going to adopt. So what are the questions that these safeguards should go respond? And what are the questions that we should, quote unquote, automate? First of all, if you are head of that hospital or of that department, if you are a CIO, a CEO, or if you're at the board, there is a risk there. Are you sure that you understand all the algorithms that are running in your organization? And are you clear on how you're testing them? Locally, with the data set, pre and post, keeping track of the delta? Are you assessing for bias? Do you have, things that allow you to take action and make sure that, the bias is addressed? And then finally, do you have overall an Gen AI governance system in place? And when you think of that, you need to think about how a standard is implemented, right? Starting from those principles with clarity of goals, some of the requirements that need to be put in place, and then the tools and practices that you need to have within the safeguards and within the solutions from an AI perspective. So all of those things have been embedded from a technology standpoint into what we call responsible AI safeguards. And so train as an initiative, first of all, as an objective to shift from principles to operationalization. That's very important, to give concrete tools, to have a collaboration amongst the members, and make sure that we could get, imagine if we could have an AI outcomes registry. So a place in which in a transparent way, is it for algorithms used in providers, in payers, in medtech, or in pharma. We started from the provider space. You could see the AI algorithms and the outcomes pre and post, and what's the delta. We are used to outcomes registries, right? And we know how important and valuable those are. And similar thing could be done in this sense. And then, of course, aligning to the standard bodies, make sure that everything is very clear in terms of how it's implemented. As I go towards the end, I want to give you an example of what we call safeguards. At the level of application, at the level of AI models, or at the level of the data, at the 3 levels, some of these considerations have to be kept in mind, and the way in which the applications are built, the data are treated, or the models are running, need to have an alignment to that checklist. And that gives you the assurance, the confidence of the implementation of those responsible AI systems. And here is the health-specific safeguards. So these are things that we have created and we have embedded into the healthcare AI solutions to make sure that the doctor can focus on what they do best, knowing that not only AI will make them save time, but also it will be responsible application of the process that has been transformed. Because for the radiologist in the example I gave you before, for the clinical trials matching, for the patient-to-doctor consultation, that becomes seamless, without no tools, just human contact. All those things need to be addressed. And one needs to have confidence in the tool that one uses. So there is no culture today, no education, no playbook. There is no manual in which you really go and say, how do I use and trust a Gen AI-enabled process? There's none of it. We don't learn it yet on the medical school. There's a gap between where the medical education is, where the regulatory framework is, and where technology has jumped to. And so we take it upon us as AI leaders to help bridge that gap. We absolutely need to do that because we believe that AI can bring a healthier future, and therefore it needs to enable a responsible implementation of that AI opportunity. And with that, I'll close. Thank you very much.
Maybe
there was a question in the...
also, maybe if there are questions from the...
Yes.
And then we'll take online questions.
So thank you for the very interesting presentation. I work for the European Federation of Nurses Associations.
Yeah.
So we represent end users. And I was wondering at what stage really... Oh, thank you. Thank you. As I said, I represent the European Federation of Nurses Associations. And I was wondering at what stage does the perspective of the end user come in? Because I understand that the end user is involved when it comes to validation of the product, of the outcome of the... But are end users involved already during the development of the AI model?
You could not have asked a better question coming from the better user group. So last year, the example I shared is doctor consultation, but we're developing the same capability for nursing. And so as we started that development, the product is not available yet. Last year, we did, US first, a pervasive set of roundtables with nurses, chief nursing officers, all level of nurses, different hospitals, from children's hospital to elderly care. And we said, this is the roadmap of development. This is the early experience that we have with the DAX program. How do you think you're going to use it? What is paramount for you? So absolutely, I believe that part of the success of any of these solutions, but even before GenAI, right? And now we have the capability to develop faster. So we have also the capability to get better and faster feedback from the users. So we're doing it. We've done it in the US. And as the product roadmap evolves, we'll be doing also for other regions. Because, of course, some of the developments have some differences. Also just language complications and all of that. But yeah, it's foundational, I would say. Thank you. And always happy to collaborate with your organizations. Anyone else?
We have one question.
There is one there.
Yes.
Thank you very much, Helena. So I have two questions, actually. The first one is, I can see that we are in part of evangelization on your side. But what about the training? So next step will be training.
Yeah.
And we know already that hospitals are fighting already with a lot of budget questions. So I wanted to have your opinion on this. And the second question is about the trust and empathy, maybe.
Mm-hmm.
You didn't mention it at all. Do you work on this part as well?
Yeah. Thank you. So let me start from the last one, because I think it's part of adoption. So there is trust and this empathy element. And the empathy element needs to be looked in two ways. First of all, I don't know if you have seen, there is a book that outlines, it's called Sparkles of GenAI. And it outlines how a doctor addresses some of the questions of the medical exam and how the algorithm does. And the algorithm is much more empathetic, much more. It's a question of time, not that humans are not polite. It's just that you have less time, sometimes a little bit more brusque, right? It's like in 7 minutes consultation with a patient, you don't have much time either. So the moment in which you apply some of these algorithms, the empathy, the ability to look at context, because the way it's trained, right? So for example, there was this example of this little girl, 12 years old, she was having some conditions, but then the algorithm said, I'm also concerned that the girl maybe could feel anxiety because with this condition cannot go to school and so on. So I think there is a big opportunity there, and we see it also in the engagement with elderly, with the avatars. In some cases, really, is it agents, bots, avatars? There's a big push to have this humanoid, right, that has an emotional and a visual face that makes bond with the patient. So there is all sorts of developments there, which also brings an opportunity to do better training. Because some of this training, let's take MedTech, for example. How do you apply something, just do a procedure from an inhaler to a patch and so on? Training is laborious and oftentimes is done very quickly or not done at all, left to the patient. And that can be done with empathy, with time, with a digital support that has GenAI capabilities in the background, so can keep answering questions that any human would be very sick and tired to answer after 5 minutes. So there is an aspect of training of how to use things, and then there is an aspect of how do we train people in the hospital, because there is no time. And that is, I think, not only a question of money. You're right. It's a question of time available. So we're doing, I'll say, we're doing our piece. I think we need to work with university hospitals, because I believe it starts there. You need to start training that new generation, but also then work with the boards and with the CEOs to make time for training people on the new tools to do medicine. Because if you think that applying Gen AI to a dismissal, like a discharge letter saves on average 12 minutes, right? It can free up time that can be used to do something else. Just the whole process of discharge can be shrunk significantly, saving money, saving time, reinvest that time in training, make sure that the workforce is upskilled, and from there, a virtuous cycle. So it's a long answer. Sorry, just ideas. Yeah. Last one?
Hi, Lena. There's also some questions online, which I'll read out to you. The first one is, excellent presentation. Please, seeing as Europe is at the forefront of regulations in AI, how is managing these regulations with building AI tools? Isn't there some sort of conflict?
How is managing what? Oh, yeah. Okay. I mean, conflict is, thank you for the question, online participant. I think conflict is a bit of a strong one. I think there's tension, right? Because as I was mentioning before, I think technology develops at a pace that is faster than regulation. And so I do believe that is the consultation, the engagement is the opportunity to have stakeholder forum, like the Health Data Innovation Council is trying to bring together, that allow almost like to narrow that gap so that there is better listening and a better fine-tuning of what are the technological requirements, what are the adoption imperatives, what's the feedback, and then how it should be implemented into a regulatory framework. And that's why we have, at Microsoft, we're very fortunate because in addition to the people that develop the products, the people that do the strategy go-to-market and responsible for the industry, that's my team, we're people, like Gabriel and Chade and in our government affairs organization that really try to do that bridge of how do you make sure that we feed input to regulators and we shrink that time. So it's tension, I would say, but healthy tension.
Thanks. We have time for one more question. There's another question online, which is, once AI will be integrated into medical diagnostic assistance, what will be the legal responsibilities of the doctor who made a diagnosis that does not turn out to be optimal?
I need my lawyer. I need a lawyer here. So I don't think that, first of all, the responsibility for that algorithm remains with the device manufacturer, right? So there is a piece there, but it depends really on the specific example. It's very difficult to give a general answer on that one. Yeah. Thank you so much.
Thank you so much, Elena.
Thank you.
That was good.
I'm going to take my computer back.
Now is time to discuss together with Martin Kanter, an AI and data expert from the FAR Institute, about a different approach to regulations, that is the use of sandboxes. And please welcome Martin to the stage. Thank you.
Thank you. So if I'm not mistaken, you've already very fastly seen my slides.
You will.
Just waiting for them to show up. Well, in the meantime, I'm actually very thankful also to Elena to mention the tension between innovation and the regulatory aspect, because it's basically what I'm going to be talking about. It's to find the right balance between regulation and innovation when, well, going in a very fast and fast-paced space such as AI. So well, I'm going to start with all the slides, I guess. Then. So my name is Martin Kenter. I work for an AI research institute based in Brussels, which is the result of a collaboration between two universities in Brussels. I had a couple of slides to present the institute, but basically we try to make the link between the universities and the public administrations, as well as support wherever necessary the public administrations in different fields of aspects, such as research, education, but also community participations and citizen engagement. We have a couple of infrastructure also if you're interested in investigating that, such as a test and experience center and big screens that we called our cave, which is a computer augmented virtual environment which allows to visualize on huge screens, like 2 or 3 times the size of this one, many different projects that we've implemented, linked mainly to digital twins, but also collaborative participations. And one of the use cases that we're looking at is also in healthcare to be able to share basically images of people performing operations, surgery basically for others. And so, well, without the slides and working, well, I'm going to be mainly speaking about regulatory sandboxes. I'm not really sure how many of you have already heard about the concept of regulatory sandbox and are aware of the latest development in AI regulatory sandboxes. Don't really see, yeah, a little bit there on the left. Okay, good, not too many people, so it will be useful. I also have my computer if needed. Good, thank you. Is this working, this one? It's still black on the left side also. Right, well.
Well, while we wait the slides, there was a reflection I had. Stacy, Martin, and it was something that Elena said. We are working on uncharted territories when it's about defining trustworthiness. And this is connect me to something that Andrea mentioned before, that we see when we develop AI systems, is that there is the tension to tell us, explain us what these things does. And we say, I mean, these models, they have a certain level of, that you cannot explain what happens inside. Like, you cannot explain exactly what happens in your brain. And so it's the trustworthiness is a way forward to establish trust between machines and humans, specifically in these areas. And so we will see that machine will become more and more efficient, more accurate. But trust is a basic concept that, and Elena said well, is uncharted territory there. Are we? Yeah, I think. Cool.
Okay.
Martin, the floor is yours.
Thank you very much. Okay, we can directly skip the 3 first slides, go to the regulatory sandbox part. Yeah, the Silfari, so 2 more. 1 more. Yes, perfect. So to explain a little bit the concept of regulatory sandboxes, They historically originate from the 2008 economic crisis, which was mainly a side effect of fintech sector moving quite fast and wanting to innovate very fast without actually taking into account the potential issues of going too fast. And the UK, United Kingdom, came up with an idea of why not let's try to allow the fintech sector to experiment with new technologies, new ideas, and new projects, basically products, in a controlled environment, so that we can directly investigate with the regulator whether something is going to go wrong or not. And that's basically the idea behind the fintech sector. Relating to AI, one scandal that everybody knows about, I guess, is the Cambridge Analytica one, where they started using chatbots to try to influence elections. With regards to Gen AI recently, for the Belgians among us, I think that you all know Jean-Luc Dehaene, who is now deceased, but basically a couple of times, and also in Switzerland, they used images of political actors, politicians, basically, to try to make them say a message, either because they were deceased but still a member of the party, and so the party reused their image, or because it was a political opponent and reused their image to try to give them a different message. So we really see that technically it's like a little bit unclear about whether it can be done or not, but practically speaking, everybody knows that it should not really be used. And so that's where the problem of balancing innovation and regulation comes from, and the tool itself of regulatory sandboxes has popped up. And so, in the AI Act that has recently entered into force, there is an exact definition of what an actual regulatory sandbox means. So, clearly speaking, it's a concrete and controlled framework set up by a competent authority, for which it offers the providers or AI providers, potential providers, the opportunity to either develop, train, test, and validate their AI system in a real-world condition most of the time. The AI system itself needs to be innovative, and it follows a specific sandbox plan that has been agreed with the regulator for a limited time. So it's really about having that framework where someone can come with a new idea and test it to see what can go right or wrong. Okay. The objectives of the sandbox, especially as described in the AI Act, is first to improve legal certainty. So when stuff comes up and people have new ideas how to use AI in a new concept or a new methodology, most of the time the regulation is either not up to date with that or sometimes not even considering that. It can also be that the regulation is like way too restrictive. I'm going to give an example afterwards, where no one thought that one day we would be using AI, and so basically the law is way too canvassed and does not allow for other usages. It's also about sharing best practices. So it's not only about the regulatory aspects, but also about trying to teach the community about what are the best practices to use in specific circumstances or specific context. Because a little bit like when GDPR came out, a lot of people were, during the initial 2 years, not really looking at the exact article, but rather just, does it concern me? Do I need to actually apply that in my specific use case? Do I need to do something specific about it? So there was a lot of work that had to be done just to teach how to interpret the law, and also what are the good practices when applying the law in that context. It's also about fostering innovation, because we can then help and accompany the new companies when they're trying to do some stuff by supporting them, not yet, and to contribute to, can you go back a little bit? And to contribute also to the evidence-based regulatory learning. So when you directly put the innovators in touch with the surveillance authorities or regulators, it really allows that iterative process on how can you actually move forward best. And so for the Union of Markets in the EU, it's really about facilitating and accelerating the adoption of new technologies in a controlled way. Yes? So in practice, what does it look like? There are 3 different types of services that can show up in a regulatory sandbox. The first one is the basic service, depending on the amount of resources that you've got available. That's what everybody's supposed to be doing, at least in the context of the AI Act. It's mainly about risk assessment and compliance coaching. So basically providing support from the regulators towards the innovators about what needs to be done and how to interpret the law, so that's, it's not really a complete jungle, but you know what to expect. Second aspect could be then linked to an extensive service. So basically making the link with data sets, physical infrastructure to be able to do testing, also some type of business advisory development and so on, and linking also then to the rest of the European ecosystem. I'm here naming, for example, the test and experimentation facility. There are 4 domains of TEFs in Europe, and one of them is actually TEF Health. I don't know if you've heard about it, but it's quite important, if you haven't, that you take a look at this, because as an AI innovator in the TEF Health, spread over Europe, you can actually get access to data, you can get access to experts, you can get access to different type of infrastructure if you need it, or just support to find funding. You've also got the European Digital Innovation Hubs that will accompany you also in the development of your company, project, and so on, data spaces, and so on. So really that whole support structure for AI innovators is very important. And then finally, and where the full service of the AI regulatory sandbox comes into action, is the liability limitation. And there we're speaking basically that when in a sandbox plan, you're wanting to test something to see if it goes wrong, and you're basically a little bit too much controlled by a specific law, the regulator can come and tell you, well, for your specific use case, just in the context of testing that specific project, well, we're going to be waiving a little bit that regulatory aspect so that you can test it, and we can learn together whether the law actually does make sense or whether it needs to be updated or not. And that's last bit is also very important for innovators to think about, maybe you're not really constrained by the law too much, but we can go a little bit further and try to see if the law even makes sense here. In terms of stakeholders, then of course, you've got a lot of different stakeholders around the table. The main ones that we need to know about are specifically for the authorities and the regulators, the national competent authorities. They will come in place and are supposed to be named. They don't exist yet in Belgium. I know that in Spain they have one already, which are basically the agencies that are going to be making the link with AI and with the different regulators. The problem being that AI being a transversal competence and, well, technology, is difficult to have each regulator being knowledgeable in AI and how it can be applied to their sector. Yes. Sorry? Okay, good. Thank you. So to make it a bit more clear also what the actual procedure is for a regulatory sandbox, you're supposed to be entering through a single portal, coming up and basically applying for the sandbox plan to see whether you're eligible. Maybe your question or your project has already been selected before or something similar that it doesn't really need a full plan. You can then start preparing that if you get accepted with the regulators following specific sets of standards if they exist yet. You can then get passed to the testing phase, which usually then either happens in the test and experimentation facilities, or sometimes if you've got specific constraints in your own facility, it can also be done. So there, the regulatory sandbox does not mean that you need to move outwards of your system, but you can still do it within your system, just having being accompanied by a regulator. Then finally, you get to the evaluation part where the report is written and that knowledge is shared with the regulator and with the other stakeholders that might learn from it. So the role of the sandbox is not really to only regulate, but rather to facilitate the communication between the innovators and the regulators themselves. So it's really like more of a facilitator role. Yes. Yes. So in the context of the European ecosystem, to really understand exactly what the role of the sandbox is, you've got the AI board and the European Commission that are mainly the transnational regulatory framework. They collaborate with the national market surveillance authorities. Some of them, for the moment, are not even named yet for AI, or some of them don't know yet that they're going to be competent in that matter. For example, I spoke in June with the agencies for medication in Belgium, told them, okay, what are you doing about AI? They told me, well, we're using that mainly to scan through documentation. I told them, well, if a company now comes and develops a new medication, finding new molecules through a shortcut using Gen AI, for instance, what do you do about it? And not only did they not know that they potentially could be liable, sorry, not liable, but responsible for regulating that, but also they knew they don't even have the knowledge in-house to actually accompany that. So there is a lot of work there that still needs to be done in terms of legal organization on who is going to be responsible for what and who needs to manage what. And that's now being finally put in place. And, well, after that, you've got all the support, infrastructure, and actions with the local testbed, the TEFs, the computer infrastructure, and so on. So as an innovator, should you need any of those resources, building blocks, basically, they are accessible to you. You can basically use them whenever you want and whichever you want and you deem necessary for your own stuff. So To give also a broad overview of what's happening in the rest of the EU, in the Netherlands, they've got already a working regulatory sandbox with all the procedures put in place, and they're now testing it with a couple of companies locally. In Spain, they had a pilot project that started, supported by the European Commission a couple of years ago. Unfortunately, due to limited resources, it has been stopped, probably potentially then starting again, but they already have the, I think it's called the ACA, something like that, the AI Surveillance Authority, named. I know that in Sweden, for example, we're also working with them. They're working with RISE directly to try to build one and building that knowledge. In Belgium, where we are now trying to accompany also the Belgian government with that, they have started the approach, the work to actually develop it. But also one of the big problems in Belgium is that there is no regulatory framework around liability waivers. So some of the regulations still needs to be there, to be modified there to just allow regulators to be able to say, well, we want to test something for you. Let's limit liability in this specific scenario. When I'm saying liability, I'm not saying that you get complete free pass to do anything. You're still liable for any potential damage. It's just that if something goes wrong, you cannot be fined for potentially going wrong as long as it was following the sandbox plan. And with regards to the timelines, basically, member states in the EU have about 24 months to comply with the legal aspects. So they should have, by August 2026, an AI, well, at least one national AI sandbox that's going to be working and operational. Additional information will come over that from the Implementation Act, because it's still a bit unclear about how it should be working, why it should be working, but for the moment it's an iterative process of how to define that and what works for each country, depending on whether they're going to be more federal or more regional in their competences. So I wanted to finish a little bit with illustrations about what can go wrong or why sandboxes are actually useful. One example, I'm not really versed into the health sector, so I had to take examples from stuff that everybody could easily understand that I could also present. One example is basically using ANPR cameras in Belgium. ANPR is basically the short for automatic number plate recognition cameras. And in Belgium, the specific law is only the police is allowed to treat those images. So it's very limited because when they wrote those laws, it was, well, they didn't really think about AI at all, which means that now they wanted to start using those cameras to detect whether people were using their mobile phone while driving. It's a simple use case from an AI perspective. It works quite well, but the legal framework is so tight that basically those use cases cannot be implemented in Belgium. So they can be implemented in other countries around Belgium, but not yet in Belgium. That's typically the example where you would say, well, we need to update that, but where do we find the process to be able to update the regulatory framework? Well, AI regulatory sandboxes could be a good example for that. Another example, which then can probably be very close to the health sector, it's about using real population data to make simulations or to see what's happening. Due to GDPR reasons, it's very difficult to actually use real data. It's quite complex to obtain and quite complex to treat also. So one university, the UCL in Louvain-la-Neuve in Belgium, had an approach where they said, well, instead of using the real data, from the real data, we're going to be building a synthetic data set, which is completely fake, so that we cannot recognize anything anymore, but you still have the same statistical distribution in the population. And then afterwards, you can start studying how the population reacts or how it behaves. And there, this type of use case is actually very useful, not to update the regulatory aspects, but rather to take the good approaches, the good practices, and share them with other potential practitioners to tell them, okay, this is actually allowed, this is a good idea because you become compliant, it's easier to do, but also it's actually valid and it's working well for most of the use cases. So building that basically community of knowledge with regards to AI is very important. And that's basically the idea behind the regulatory sandboxes. All right, I don't know if you have any questions about this.
Just to make sure I understand, right, so you have different sandboxes in different countries, they work with different stakeholders, the competent authorities. Is it a model where if you are in a country, let's say you are in Madrid, it's going to be with the competent authorities in Spain and not the others? The reason I'm asking that is that, you know, we know very well, look at GDPR, for instance, that the competent authorities don't have exactly the same, you know, view about what things means, interpretation, and they put the bar at different levels. So that could lead to maybe competition between different sandboxes, and we've seen that in fintech as well, where, you know, startups people that want to innovate prefer to go to certain place because it's going to be easier for them. Just to understand if the model works really, member state by member state, or if you go here, you might test that with competent authorities in a different place, right?
Yes, twofold. Well, AI regulatory sandbox are not really isolated from the others. So basically, the problem that you mentioned for the fintech sector is going to be exactly the same for the AI sector. It's not really specific to AI anyway. The thing is that also for the moment, they list that they should have eligibility criteria, access criteria, and so on and support. However, it depends on how the member states are going to be implementing that. So of course, depending on where you want to go, where you want to operate, it might be interesting to go to different member states to test it, but it might also be that the legal frameworks, and I gave the example of Belgium for the NPR cameras, is different member state per member state. So you will have to comply with that.
So my question probably, and I don't know if there is a clear answer to that, but I would like to also hear maybe your view on this. So one of the high-risk categories within the AI Act is medical devices.
Yep.
The medical devices regulation does not allow for a regulatory sandbox today. However, on the AI Act, there is that possibility. So it's more in between the interplay between the two pieces of legislation, because as we incorporate AI in medical devices, or AI as a medical device, we might need actually in some instances, as you say, to explore maybe in real world conditions, maybe different scenarios or alternatives.
Yep.
So I don't know if you have any advice or any opinion on how that actually could potentially work.
I do not know yet completely, but I know that the vision is to move forward with the use of AI regulatory sandboxes, at least actually regulatory sandboxes on a lot of different domains. Because I've seen that it works quite well, and if you want to promote innovation, and not only AI, but in any sector, having a collaborative process with the regulators to be able to evolve is very important. And so for AI specifically right now, regulation is now being studied or written, or even the process of the sandbox is being updated to see how it works. So there is, that was actually also on the slide, but there are a couple of coordination and support actions that have been launched by Digital Europe on first, helping member states to understand what sandboxes are, helping them also to make the link and implement them in each country, but also helping them then update their regulatory framework, basically locally, to allow then that part to be done. So it's really being done or being worked on at the moment. It's not ready yet, but it will come in the next 2-3 years for sure.
Okay, Martin, we also have some questions online.
Mm-hmm.
There's one from Nina Laurinkare. It's quite a long introduction, but I'll try to summarize. The testing environment will not be real world, so will there be real added value? Not many companies will have time to create entire artificial data sets or to go to different member states. So basically wondering whether this nice concept may remain an empty invitation for a playground tool with no to few system developers and hence no fertile ground for best practices. What are your thoughts, insights?
Long questions. I'm going to try to remember each element, but I don't really agree that it's only going to be a playground. I think that, for example, with the TEF in mobility, in Belgium, we've got access to places where you can put new cameras to start collecting data or getting access to already collected data in the TEF to test your solution. I know that, for example, in the Netherlands, for the mobility part, they've actually built a fake, a couple of streets and buildings to be able to test autonomous vehicles. So I do expect that for the health sector is going to be exactly the same, where you will have specific playgrounds in which you can also test your device in the best real-world conditions. The idea is not to cover all the risks or to do everything, but at least to facilitate testing as much as possible the way it can be done in a controlled and safe manner for everybody.
Thank you, Martin. Thank you. So now, as we move towards the end, there is we invited a panel of experts. I would like to invite here Tineke to the stage, and Sophie and Gabriel. So Tineke Van Hollen is the Deputy Secretary General of Bio.be Essentia, which is represents a federation of companies active in the biotech and life science industry. Sophie Tomlinson, she's the Director of Partnership and Communication at DataSphere Initiative. And then they are at the forefront of promoting responsible data sharing across sectors. And she's going to continue the discussion about sandboxes. And Gabriel Lopez, that is Director of Government Affairs in Microsoft. And so I will actually, this chair is for me. So I'll sit and I'll ask a few questions to them, but then I will cut it short and I will let you also have the time to ask them a few questions. And the first question I'll go with Tineke, and it's about your views about reshaping drug discovery and development process, and how the AI technologies contribute to reshaping that. And what are your views?
Okay, thank you. Is this working?
Hello.
This is working? Yeah.
This one is working. Great.
Great. So first of all, thank you for the invitation. And it's always nice when when the biotech is invited by the tech, because this is, of course, the way to go. Now, to come back on your question, you know, I've been active in the life sciences sector for more than 20 years. And I've seen in the past years that there's really an acceleration and an interest in terms of using digital technologies in a broad sense in all of the steps of the value chain. So it's not only in discovery, it's also in terms of clinical trials. Also, the biomanufacturing processes are using digital technologies to enhance their activities. And that's really good, because that is the way to go. We have a couple of examples. You talked about drug discovery modeling. It was used during the COVID crisis. So the possibilities of AI in the biotech sector, it's there. The technologies, they are there. Also in terms of diagnostics, when you look at diagnostics in terms of some cancers, it is used today in hospitals. And also in terms of the manufacturing processes, AI technologies are being used. So the technology is there. And it was great to hear the previous speakers as well, because the one big thing we need to take into account to have the patients and the physicians with us is trust. And when the trust is there, people will say, this is what I need. Because imagine there's a patient, or imagine you have cancer, and imagine they say to you, by using these technologies, the chances that you will cure from it are much higher. Everybody will say yes. The danger today is that when these little movies like Politicians which are dead are being used to keep them alive, people, they get fear. And the danger is that also then they say, well, the use of data in the health space, we don't want it. So if we can work on the trust and the buy-in of the end users, of the patients, of everybody in the ecosystem, we will do much more in terms of using these technologies.
Thank you. Thank you very much. I'm always seeing these science fiction stories where human and machines, luckily we are still not there. And in the drug discovery, there is, as you said, a huge potential and a huge investment also going in. And Sophie, your views on how sandboxes are evolving and how actually your lesson learned into this space of making it practical, and in particular, making it an ethical space, a practical space of sharing data. What are your views on that?
Thank you so much. Just for people who don't know us, we are a think tank working on data governance and sandboxes and have been around since 2021. We're based in Europe, Latin America, and also Africa. And yeah, it was great to be not the only person in the room talking about sandboxes. So thank you so much, Martin, for your great overview there in the European context. And for us, we've been basically trying to do research and analysis on how our sandbox is being used around the world to test things like AI, privacy-enhancing technologies, and also share data more and more responsibly. And this discussion today has been really helpful in just highlighting for me also what the value of sandboxes are in terms of creating trust, creating knowledge between regulators and also the private sector. Also being able to dig into some of the transdisciplinary and cross-regulatory frameworks we saw with Microsoft's tech stack analysis, and also the question of, how do different regulations interact with the AI Act? Because that's the question. And I'm hopeful that sandboxes in the EU context are going to be able to dig into some of those questions and challenges. In terms of our experience, we've been looking at how some sandboxes have been used in not just the UK, who has been a pioneer in the fintech sector, but also Singapore and Norway outside of the EU are also real leaders in sandboxes. In Africa as well, there are many, many really interesting examples of how sandboxes have been used in the fintech sector. But more interestingly for you, we will be starting a project soon with the Africa Centre for Prevention of Disease Control on a regional sandbox on how to actually track diseases. So this will be a cross-border sandbox. And I think also that's a very interesting way to think about the potential of sandboxes, especially obviously in the health sector itself. So maybe I'll leave it there, but happy to build on and share about what we're doing.
Thank you. And sandboxes started in fintech, but they are expanding to other sectors. And there is an interesting view of use cases in the pharma sector and for sandboxes. So that's why we are bringing this topic to you for the healthcare, and also it could be, as the AI Act is pushing towards sandboxes, is also in the relation to medical devices. They also there are not yet example in Europe, but we see those probably coming in the future, and so we're liking to discuss further and to demystify, finding how this can bring practical results. And Gabriel, you are tasked with a difficult, because as a government affairs at Microsoft, you see the challenges of bringing innovation and fostering innovation, and on the other hand, you have data, like health data, that are sensitive. How do you actually handle these concern around data, healthcare data, surrounding the healthcare data, and how you are driving innovation in that space?
Thank you, Stefano, for the question, and thank you all for participating in this event. I want to address this question. I want to share with you a story. Very recently, I participated in an event of lawyers from different fields, and in one particular panel, there was the attorney of one major company that is dedicated for tools for basically appliances or drills and so on. And he asked us, "What do you think that we sell? Do we sell the tool that actually does the job, or what do we sell?" And he presented a picture of a hole in a wall. So what we sell here, it's actually the solution. So when I'm asked about this, why we are here today, we are here actually to share knowledge, to learn about the best practices, to tackle one of the main challenges for our civilization, how to improve healthcare in the future. Now comes the question, what are the tools needed to do this? What are the guardrails that need to be put in place to assess those risks? And one of the key aspects of it is actually privacy, together with innovation. it's not a simple task. We have heard about sandboxes and other initiatives on how we want to balance between the go as far and as fast as possible, protecting those values that are important for us. And I think that we need to have a very strong reflection on this. Just coming out from the Draghi report, there is tons of knowledge that is coming out from how GDPR has been addressed and implemented, and how much needs to be done to continue bringing the social benefits of the technology while protecting the security and the values of this region.
Thank you. Thank you. So we have a representative from the biotech, representative of data, partnership, data, and talking about sandboxes. We have Microsoft. Please take the opportunity and to ask your questions. Otherwise, I will continue my questions. But if you have a point of view you want to share, questions, statements, or please come forward. This is a debate for... online, do we have any questions online? No, then I'll continue. I'll continue because I'm interested to understand how your association is actually promoting the use of AI within its membership, and what are you doing in order to promote the use of AI, and knowing also that as an association you probably have to deal with the intricacy of the regulations, and so you have to balance somehow your views.
Yeah, we do a lot of advocacy towards government as well on the Belgian level. And as said, we are a federation. That means that our members are the biotech companies. But I will give you a couple of examples on what we're working on. First of all is sensibilization. So when we do events, we're not only talking about biotech. For instance, we had our annual event last year, and we had a speaker on AI. It was Andrei Buvaili, who is following the trends in terms of AI linked to biotech. So that's a really important thing, is to make sure that our members know the latest trends in terms of the use of AI technology in the biotech sector. The second thing that we do is how do we make sure that we have sufficient talent in the sector, in the life sciences sector, to be able to use and introduce those technologies. So we have advocated a lot towards our Belgian government to basically get funds from the Next Generation Fund that came from Europe to build a European biotech campus. This campus will be ready at the end of 2025, and one of the 4 key pillars is that we will work on digital skills. So the aim is to get trainings over there, to get companies over there. People who do not have a job today can come over there to get the right training, so that we have an acceleration in terms of available people in the sector. So that's the second thing that we're working on. And the last thing that we also do, or the last example I want to give, is we do have a working group on digital, where we have our member companies sharing their experiences. What are the opportunities? What are the challenges that they face? And so then you have the network where basically people can, share their stories, and all together we're working on the need for the digital shift in the life sciences sector.
Thank you. And Sophie, how in practice does Sandbox works?
Thank you for that question. And it's an important one, because even though we, of course, were happy to see sandboxes mentioned in things like the Draghi report and those kind of things, they're popping up everywhere now, but they are complex to set up. They require investment, skills, buy-in from the regulators, and time of SMEs who are busy, surviving, to let alone participate in a sandbox. So we see this as really important. And also, not one sandbox is going to be the same as well. So it's also quite hard to have an exact science of this is what a sandbox should look like, because that's what a sandbox is meant to do actually, is have a unique testing case in a controlled environment of a particular technology. And just before I answer your question, what I want to note is how a bit of an anecdote I was mentioning in the coffee break is governments need the support and knowledge to be able to develop responsible and useful sandboxes. At the moment, speaking to colleagues in the UK and Singapore, they were contacted a couple of years ago by, say, the Data Protection Authority of Norway to say, hey, I've seen that you've been doing these interesting sandboxes in healthcare. How can I do that? So UK, Singapore advise Norway, and then the Brazilian Data Protection Authority, they contact Norway and say, hey, Norway, let me have your expertise and knowledge of how you've been setting up sandboxes. So what we want to do at the Datasphere Initiative is build a global sandboxes forum where we can actually collect the evidence and case studies and stories, like you were saying today, of how have sandboxes worked and how have they been useful? Because this community of practice, this learning, this being inspired by not just what's happening in the EU and what the Brussels bubble is doing, but what innovations are coming out of Africa and Latin America in terms of sandboxes is really, really important. So that's something we're doing with the Global Sandboxes Forum. We are developing as well research and policy analysis on the potential of sandboxes in the context of AI, in the context of sustainability, in the context also of digital public infrastructure, which is an interesting area as well in the context of health. And if there's people here who would be interested in a similar study, but in terms of healthcare or medical devices, I'd be really happy to talk to you. But to set up a sandbox, you need to do many things. We actually have a roadmap on this that I can share with anyone who's interested, but it's finding out who the stakeholders are, who do you need to actually include in the sandbox, how are you going to define your problem that your sandbox is trying to solve, because having all stakeholders to agree and have this shared common problem is a key, obvious, but key aspect. And also, how is this sandbox going to bring in and actually be useful to participating companies and so on? So also identifying the risks for the sandbox too, because this is also, we don't want it to be a playground of anything. We want these to be useful cases for the real world that are also taking seriously the real data that these sandboxes will be hosting and using. So happy to talk more about this in the lunch break. But
yeah.
Just a question.
Yes, please.
Okay.
Thank you. So, does it work? Okay. So thanks for these remarks, and I want to ask you and think of being here again 5 years from now, and what are for you the two parts? One are the low-hanging fruits that we would have achieved by in 5 years, and what should come in the years we want to be discussing at another event as such, if you would come back.
For Sophie or?
Actually for all the panelists.
What a question. Fantastic question. When I wouldn't like to go like 5 years. I would like that by next year, the promise of developing technology sufficiently powerful to tackle the main diseases in the world would be extremely useful. In the next 3 years, I would like to see technology supporting physicians, nurses, and all the ecosystem in addressing this generation that, in the case of Spain only, 50% of the physicians will be retiring in the next 5 years. 50%. That means that they won't just stop providing healthcare services to the population. They will become consumers of the healthcare system. So how we are going to tackle that problem? And I think in the next 2 to 3 years, we need to come up with great solutions to get that done. Otherwise, we will start seeing the erosion of one of the key pillars in our societies. How to get there, in my view, is it has to be with the industry, of course, but we need as well the right policies. And when I say the right policies, it comes to people. When a organization, an institution, a government, whatever, appoints several people into key positions, that is actually policy. Because those people are to implement these type of visions. And if we come together that, hey, this is the problem that we need to address, let's find the right tools to get it done, I think it's going to be easier for us. So it's a long road, it's going to be a hard one, but we need to exchange knowledge. We need to sit down together as industry, as citizens, as public institutions, and so on, because it's not going to be easy.
Oh, sorry. I was just going to build on what you said in terms of we need the right policies, and I agree, and you mentioned tools, and for me it's we really need the new tools and the right tools. So I'm really hoping in, say, 10 or 5 years, there's some good, promising sandboxes that have been set up in the context of the AI Act or so on in Europe, but that have been informed by experiences from other sectors and also from other regions of the world as well. I think that's really important. And so I would say, and then in 10 years, I would say, I hope that there's more of a recognition and a more kind of agility in governance and in regulation, that we accept that we don't just need innovative technology to solve some of the challenges we have, but also regulatory innovation as well. And I feel like to do that, we need innovative regulatory tools. And Sandbox is one of them. There's others as well. So just to emphasize, it's also not a magic solution that will, embrace everything. But thank you.
Yeah, thank you. And to build on that, because you say 5 years, then I say, okay, let's have a dream. So within this and 5 years, let's make sure that AI is used as a no-brainer. It's used as kind of normal, and we don't pose any questions around this anymore. Two, that there are no new regulations trying to regulate something else, which we often see, and maybe let's dream of having new technologies, even other technologies than AI, which will help the sector even more. So my main message is no new rules, let innovation thrive, and let's make sure that what we have today is that we can use it in benefits of the patient.
Thank you. Thank you. It triggered also my curiosity. I was thinking, and my question is, will radiologists exist in 5 years' time? I don't know. I don't ask you, do you think they will exist? We don't know. I don't know. But for sure, what I know is that the radiologists that will not use AI will not exist anymore. That's for sure. Anyway, there was a question on the back. Yeah.
Yes, but after this high-level statements, my question, which is much too down to earth.
Let's go down to earth.
No, I will not dare to go down to earth.
Yeah.
I will change my question. Okay. What I miss here for the moment is that we have been working very much on the cure aspect, diagnosis, treatment with AI, better caring people. We have not yet worked on prevention. We have not yet reflected on how the healthcare system can better integrate AI to do prevention, to do population management. And if, as you say, we will be short in resources, short in staff, short in blah, 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 and all kind of resources in healthcare, if we don't do prevention and if we don't really transform our system to do more prevention, we will not solve this problem that you identified. So that's the comment that I would like to make here. Prevention, AI, prevention, healthcare systems, working at healthcare systems is something that I've been missing today, but we cannot do everything today in one day, but that's what I would call for a next session.
Thank you. Thank you very much for this fundamental point that you raised. about population health. And any of you wants to comment on that?
Yes, I would like to. Thanks for the comment. And to me, your point is actually empowering the patients or the citizens. And how do you empower them in the context of these conversations? First, by letting them use the tools and their data. For me, it doesn't make sense, for example, if I move across specialists or hospitals, that my data is not portable, for example. Or that I cannot use a tool to basically tell me in clear terms what those X analysis is telling me that I'm having. And the prevention will be, means we need to empower the citizens to prevent and to take care of their health. I completely agree with you in that area. Now, just to finalize, the way that we have seen this evolving is not only on the citizen side, but as well, one of the conversations that we had within the council, there was an expert coming from Association of Nurses and Physicians from the US. And they were asking, one of the key gaps that we're having right now is that we don't have data on how our doctors are feeling, on how our nurses are feeling in performing the duties that they are doing. And what we see in all the hospitals and in all the systems is that many of them are burnout. So 7 minutes per patient, that means that, wow, that's a lot of work to be imposed in one individual. And that data is missing in many, many systems. Sometimes we need as well to take care of this community, to free them, and actually that will have, in our view, a cascade effect into the way these people are being treated. No?
Thank you, Gabriel. Tineke?
Yeah, I just wanted to say it's a very valuable point, and indeed when we talk about healthcare, when you invest more in prevention, in the end, it will also have a positive effect on your healthcare budget. So I'm fully with you. We also fully plead to have more funding. Now I talk from a Belgian perspective, to go more funding to prevention in the entire healthcare system. And let's hope that the availability of technologies can help us bring that message, because that will be the first step. Have more funding in prevention, and then you can do more activities in that one, but we are fully supportive.
For sure, AI will have a greater impact on society, on prevention, that's for sure. There are complexity also in that sense. Andrea, when he talked about before, about his experience on CKD, chronic kidney disease, he didn't tell you that once we have reached a level of accuracy of prevention of the disease, in a very simple manner, by urine and blood sample, we went to the government and we provided the algorithms. And they said, oh my God, this means they start to calculate the cost of calling the population that is basically healthy. And they said, we're not going to do it. It's too costly. And then who wanted to acquire the algorithms were the insurance company. They say, if I know who is going to be sick, I'm going to increase the premium. They said, no, we're not going to give it to you. We'd rather keep it and wait. So it's definitely, for us, it's very important, that area, because that's where the impact of AI will have a greater significance. I don't know if I stole your word.
Oh, I was just going to say, in terms of the cross-border aspect of data sharing, actually tracking diseases that we know go across borders. For me, that's still a gap that has been figured out by different types of regulatory frameworks and so on. But for the healthcare system, I feel like that's a key one.
Thank you. We take one more question, then we come to the conclusions, I would say. Thanks.
Thank you very much. I would like to build on the previous question because I would like to ask if AI cannot already help in prevention. As we know from an extensive body of research, if you do physical exercise, if you eat healthy, if you hydrate yourself, if you eat less salt, you can reduce certain risk factors, and you can therefore reduce the probability you'll get cardiovascular disease for some reason, for example. So then, cannot AI already help in, let's say, steering people's lives towards a more healthier approach already? I mean, even the co-pilot, can't co-pilots do that already in terms of prevention and not necessarily requiring a medical screening and things like this?
I just think I would answer that by saying that's assuming that people have access to time to do sport, the money to buy healthy foods and low salt diets. That's putting a lot of onus on the human, which I agree is an important factor. But for me, that wouldn't be the way to build.
There is a complexity. There is this complexity of bringing together multiple data sources, like cardiovascular disease, for example, have environmental impact factors, stress, smoke, and lifestyle conditions. And these, combining these data, harmonize with the other data sets related to echocardiogram, it's not always that easy. It requires a lot of work to combine. So that there is a complexity in that. But also, do you want actually your smartwatch take control of your life? I don't know. That is also another question that you need to ask. If do we want that to get that into the lifestyle of people?
Yeah, and to build on that, in my mind, I don't think it's the job of an AI tool, whatever the name is, to influence the conduct of people. I think the job of the AI tool is to bring the right information to make a decision when the human needs to take that decision. When it comes to, okay, how we can enable prevention through good practices of making sports, having a well diet, and so on, there is also a lot of research that needs to take place in that area of the spectrum. Because as we see, there's also tons of misinformation in that area. And currently, the existing models are not necessarily fed with the right data to properly assess or suggest in this area. My hope is that, as we have seen, if we continue to evolve and specialize these models, well, we may get the right tool to help in this area. But again, I would think that I wouldn't advise to use an AI tool to influence people to act on X or Y way. Mainly because of freedom. We still have people that like to smoke, or that like to drink, or that like to have habits that are not necessarily, let's say, recommended by a physician. But we do still need to maintain the freedom as an individual to take our own decisions, even on our health.
Anyway, they will come. They will come. It just will be us to decide whether we take the blue pill or the red pill, referring to the matrix. I think I'd like to, we are closing. I think I would like to just leave the floor to Andrea for maybe closing remarks. And thank you very much.
Thanks a lot. It won't be long. I'm the only thing that remains before the lunch, so it will be pretty fast. I was just thinking and reflecting about the preventive and prevention, all of those things, because basically, for example, we've worked in a project where we try to identify what are called volatile organic compounds from the breath of people in the morning. Because something which is pretty obvious from the people who did normally machine learning, which is totally different from what is normally happens in the healthcare sector, is that normally you do prediction from a cloud of very weak signals, while normally healthcare counts on a few strong signals. So if every morning, imagine in the future, you can breathe simply in a tube, and it will track your progression over time of the volatile organic compounds. And at some point in time, they suggest to give you an examination, a specific examination. This will be pretty cheap and pretty effective. And the same things will happen from electrolytes in urine and things like that. So there will be obviously, smartwatches and things like that, but also transformation of diagnosis rather than monitoring of the health of people. So I think that also this could be interesting, but just reflecting on the discussion. So on the conclusion, I think that one of the main goals that we have when we do such events is to share awareness and to have interesting discussion. And so thanks everybody, it was pretty interesting, lots of interaction, very interesting discussions, even from the people online. So I'm happy because we will contribute in a way, and you contributes too, by exchanging with us. So I would just, summarize some of the conclusions. There were many others which came from the questions, but I think that those will be more relevant, especially for us to share. So the first one is data is still a critical asset. So the fact that, this Gen AI or pre-trained AI is coming doesn't mean it creates an even bigger opportunity. So still staying for data for an opportunity for improving healthcare. Artificial intelligence will come and will have a very significant impact. We have Tiade, for example, that shows the Draghi reports. In the Draghi reports, there is a lot on artificial intelligence, and they highlight a use case specific for pharma, for example, which has an impact of 180 billion in 5 years, if I'm not mistaken. So it will come, and it will not only affect healthcare, but also research. It is already affecting a lot research, pharma. Drug repurposing is a huge topic and things like that. So it will have a huge impact on the sector. There are a lot of initiatives. We saw some of them, some research initiatives like EUCAIM, some trustworthy initiatives like we saw. Very interesting, the concept of the sandboxes to make AI more transparent, trustworthy, and responsible, which in the healthcare sector is paramount. As I said, the impact will not be very limited. So 93% of the production adoption of healthcare so far, of AI in healthcare so far, is on diagnostic by imaging. It's the only space in which is pretty used, but the space is huge. And so we encourage the use in many other processes and in many other parts of the industry. And Europe, last but not least, Europe is on one hand is leading the way on research, so it's doing a lot on research, but on the other hand is hindering those research and those innovation, especially when this research has to come out from the research, come out from the papers. I like a lot the question, for example, to the friends to EUCAIM, what's the day after? So when you create that, even in AIDA, we design a concept to create an association to make this research sustainable and to move towards the adoption from the lab to the market. And this will be done by collaborating and by sharing the results. So last things, just thanks to all the speakers, thanks to you for coming, and great support from the technical side. So it will be, it has been for me very, very positive, and I appreciate a lot that. Thanks a lot.